Hello, my name is Dr. Tess McPherson and I'm a consultant dermatologist and part of the research team working on this study. This was led through the Department of Psychiatry in Oxford University and included senior author Professor Fazal, who's a consultant psychiatrist, and lead author Dr. Paljarvi, who's an epidemiologist. We know that acne is a very common inflammatory skin condition which affects around 8 out of 10 people to some degree between the ages of 12 and 27. It's also known that acne can have a negative impact on mental health. We wanted to look at whether a commonly used acne medication called isotretinoin, which is often referred to as Accutane or Accutane, was associated with poor mental health. Isotretinoin is an effective medicine for moderate to severe acne, has been used for over 30 years by dermatologists. There's been some concern that isotretinoin can be associated with mental health issues. However, the existing data before this study is mixed, and previous studies to look at this have been quite small and sometimes use particular groups who are maybe not representative of most people with acne. So we aim to find out if people aged 12 to 27 years who had acne and who took isotretinoin had poor mental health than people who also had acne but did not take isotretinoin. We used a very large healthcare database from the USA, which is more patients than had previously been studied included in any such study. Having larger groups of patients allows a more accurate assessment as to whether mental health issues are linked to the medication and appropriate comparison groups. We identified 30,866 people who took isotretinoin for their acne and 44,748 people who, instead of isotretinoin, took antibiotics by mouth or orally for their acne. We used a statistical method to make these two groups of people similar for various factors that could have had a negative effect on mental health. We then used information from the same database to compare these groups with various aspects of health and mental health over a period of 1 year from the start of treatment. Because of the size and quality of the database, we were able to compare people with acne who were taking something other than isotretinoin, which is a better way to see if isotretinoin, rather than the acne, is associated with mental health issues. So what did we show? Overall, we found that mental health issues were common across all patients with acne. For example, 7 to 10% had a diagnosis of a mood disorder such as clinical depression. Patients with acne had increased mental health problems than similar patients in related studies who did not have a diagnosis of acne. We found that people taking isotretinoin were more likely to have physical symptoms including headaches and conditions of the eyes and lips compared to those taking antibiotics, and these are recognised side effects of the medication. Importantly, we found that people who took isotretinoin medication had slightly better mental health than those who took oral antibiotic medication for acne, with reduced rates for conditions such as anxiety, depression, sleep problems, non-fatal self-harm, and prescriptions for a medication such as antidepressants. So although we did not have information on cause of death, the rates were low in both groups, as you might expect in young people, and there was no statistical difference between deaths in the group who took isotretinoin and in the group who took oral antibiotics. We were only able to know if someone died while in hospital, and only 19 of the 30,866 isotretinoin patients died in the 12 months after starting medications. None of them had healthcare contacts or consultations for self-harm prior to death. So our findings suggest that isotretinoin has no worse mental health outcomes than alternative acne treatments, and in fact there was a reduced rate of mental health symptoms compared with oral antibiotics in the year after prescription. So this large study shows that isotretinoin medication was unlikely causing poor mental health in patients prescribed isotretinoin for acne. This work supports the use of isotretinoin for patients that have moderate to severe acne and should be of some reassurance to patients who are offered this medication to treat their acne. So please do have a look at our study. It's available in the British Journal of Dermatology and is open access. Thank you.